Hey everyone! This essential guide will help you maximize your VA health benefits in 2025. We know navigating the world of healthcare can be confusing, especially when it comes to understanding your benefits as a veteran. Whether you're a recent military discharge or a longtime veteran, understanding and utilizing your benefits can significantly improve your health outcomes and save you money. That's why we're breaking down the key things you need to know. We'll cover everything from eligibility requirements to specific services available. So, stay tuned and let's make sure you're getting the most out of your well-deserved VA benefits. First things first, let's talk about recent discharges. If you've left the military within the past 5 years, listen up. This is crucial. You have a golden opportunity to enroll in VA healthcare with enhanced eligibility. That means a wider range of services might be available to you compared to waiting longer. Think of it like this. The VA wants to ensure a smooth transition back to civilian life, and part of that is making sure your healthcare needs are met without unnecessary hurdles. This 5-year window is designed to catch any potential health concerns early on. We all know prevention is key, right? That's why taking advantage of this enrollment period is like investing in your future well-being. Don't let this valuable opportunity slip away, even if you feel perfectly healthy right now, and that's great. Getting established with the VA healthcare system early allows you to access preventive screenings, address any lingering effects from your service, and have that peace of mind knowing you're covered. Remember, enrolling within 5 years of discharge can make a world of difference. So don't delay, get yourself registered, and prioritize your health. Now, for those of you who have service-connected disabilities, the VA has a special system in place to ensure you receive the care you need promptly. This means you get priority access to a wide range of healthcare services. Here's why. Service-connected disabilities are directly related to your time in service, and the VA recognizes the sacrifices you've made for our country. This priority access ensures you receive timely and appropriate care for any condition linked to your service. We're talking about things like physical injuries, mental health conditions like PTSD, or even illnesses that developed as a result of your service. The VA is committed to providing comprehensive care for these conditions. This priority access isn't just about quicker appointments. It's about ensuring you receive specialized care from experienced professionals who understand the unique challenges faced by veterans with service-connected disabilities. So if you have a service-connected disability, make sure you inform the VA when you enroll or when you're seeking care. This will help expedite the process and ensure you're getting the priority attention you deserve. Let's talk about income and how it relates to your VA healthcare benefits. Now, it's important to understand that income level can affect two main things: your eligibility for certain VA healthcare programs and your copayment requirements. For some programs, your income might determine whether you qualify for free healthcare or if you'll have some out-of-pocket costs. Don't worry though, even if you have to pay, the costs are generally much lower than what you'd find with private insurance. Think of it this way. The VA wants to make sure that all veterans have access to quality care, regardless of their financial situation. So they've designed a system that takes income into account to provide the most support to those who need it most. Now, when it comes to copayments, these are typically small fees you pay for specific services like doctor's visits or prescriptions. Your income level will usually determine which copayment tier you fall into. The good news is that even if you have to pay copayments, they're often significantly lower than what you'd pay with other insurance plans. Plus, there are certain situations and conditions where copayments are waived altogether, like for service-connected disabilities. Now let's dive into how the length and era of your service can impact your VA health benefits. Here's the deal. The VA takes these factors into account to determine your eligibility for specific programs and services. For example, veterans who served during certain wartime periods might be eligible for additional benefits or have different enrollment priority groups. This recognizes the unique sacrifices made during those times. Similarly, the length of your service can influence the range of services you qualify for. Longer service periods often come with more comprehensive coverage options. Think of it like this. The VA aims to provide a level of support that reflects your dedication and service to our country. So the longer you served, the more likely you are to access a broader range of benefits. It's essential to check with the VA or use their online tools to determine how your specific length and era of service impact your eligibility. Don't assume you know everything. Remember, every veteran's situation is unique, and the VA has designed its benefits package to be as inclusive and fair as possible. So, take the time to understand how your service impacts your benefits. For those of you who served in combat zones, the VA provides additional benefits to address the unique challenges you might face. We recognize that combat experience can have a lasting impact, and we want to ensure you receive the specialized support you deserve. One of the key benefits for combat veterans is enhanced eligibility for VA healthcare. This means you might qualify for a wider range of services including mental health care compared to non-combat veterans. The VA understands that combat exposure can lead to invisible wounds like PTSD, anxiety, or depression. These conditions require specialized care, and the VA is committed to providing it to you. Additionally, combat veterans often receive priority access to certain VA programs and services. This ensures that you receive timely and appropriate care for any physical or mental health concerns related to your combat service. Remember, seeking help for combat-related issues is a sign of strength, not weakness. The VA is here to support you every step of the way on your journey to recovery and well-being. Now let's talk about our Purple Heart recipients and former prisoners of war. You hold a special place in our hearts, and the VA recognizes the immense sacrifices you've made for our nation. That's why you have unique eligibility considerations when it comes to VA healthcare. We want to ensure you receive the highest level of care and support possible. Purple Heart recipients, who have been wounded or killed in action, have earned access to comprehensive VA healthcare services. We understand that your injuries may require ongoing care and support, and we're here to provide that. Similarly, former POWs, who have endured unimaginable hardships while serving our country, are eligible for a wide range of VA benefits, including priority access to healthcare. We recognize that the physical and emotional scars of captivity can have a lasting impact, and we're committed to providing specialized care to address those needs. If you're a Purple Heart recipient or a former POW, please reach out to the VA to learn more about your specific eligibility and how to access the benefits you deserve. Chapter 7. Primary Care, the foundation of your health. Let's talk about the cornerstone of good health, primary care. The VA offers comprehensive primary care services to all enrolled veterans. This means you have access to regular checkups, preventive screenings, and management of chronic conditions all under one roof. Think of primary care as your home base for health. It's where you build a relationship with a trusted provider who gets to know you and your medical history. This is crucial for catching potential health issues early on. Regular checkups are like routine maintenance for your body. They allow your provider to monitor your overall health, track any existing conditions, and catch any potential problems in their early stages when they're often easier to treat. Preventive screenings are equally important. These are tests and exams designed to detect diseases like cancer, diabetes, or heart disease before you even experience symptoms. Early detection is often key to successful treatment and better outcomes. And if you have chronic conditions like diabetes, heart disease, or asthma, your primary care provider can help you manage them effectively, reducing the risk of complications and improving your overall quality of life. Taking care of your mental health is just as important as taking care of your physical health, and the VA offers a wide range of mental health services to support veterans' well-being. We understand that military service, regardless of combat experience, can present unique challenges that impact mental health. That's why the VA provides comprehensive mental health care, including therapy, counseling, and medication management. Whether you're struggling with PTSD, anxiety, depression, or any other mental health concern, the VA has trained professionals ready to listen and provide support. One of the key focuses of VA mental health services is PTSD treatment. They offer evidence-based therapies like cognitive processing therapy, CPT, and prolonged exposure, PE, which have proven to be highly effective in treating PTSD. Additionally, the VA is deeply committed to suicide prevention and provides crisis intervention services, support groups, and resources for veterans who may be struggling with suicidal thoughts. Remember, seeking help for mental health concerns is a sign of strength, not weakness. The VA is here to support you every step of the way on your journey to mental wellness. Now let's discuss specialty care within the VA system. If you require specialized medical attention beyond primary care, the VA has a well-structured system for referrals and access to a wide range of specialists. Whether you need to see a cardiologist, dermatologist, neurologist, or any other specialist, your primary care provider can refer you to the appropriate expert within the VA network. Think of your primary care provider as your advocate within the VA system. They'll guide you through the referral process, ensuring you get the specialized care you need in a timely and efficient manner. The VA also offers a variety of therapy options, including physical therapy, occupational therapy, and speech therapy, to address a wide range of conditions and support your recovery and rehabilitation. It's important to note that in some cases, the VA might authorize care outside of the VA network if a particular specialty or service isn't readily available at your local VA facility. So, rest assured that whether you need to see a specialist within the VA network or require care from an outside provider, the VA is committed to ensuring you receive the appropriate medical attention. Let's talk about prescription medications and how you can maximize your VA benefits to save money on the medications you need. The VA provides comprehensive prescription drug coverage to enrolled veterans, ensuring you have access to affordable medications. One of the best ways to save on prescription costs is to utilize VA pharmacies whenever possible. VA pharmacies typically offer medications at significantly lower prices compared to retail pharmacies. The VA also has a tiered copayment system for prescriptions, meaning you'll pay a specific amount based on the type of medication you need. Generally, generic medications have the lowest copayments, followed by brand-name medications on the VA formulary. If you're prescribed a medication that's not on the VA formulary, don't worry. Your doctor can submit a request for an exception, explaining why you need that specific medication. Remember, managing your medications is crucial for your health. The VA's prescription benefits are designed to make it easier and more affordable for you to get the medications you need to stay healthy. So there you have it, folks. We've covered a lot of ground today, but hopefully, you now have a better understanding of how to maximize your VA health benefits in 2025. Remember, your VA health benefits are earned through your service. They're a testament to your dedication and sacrifice, and the VA is committed to providing you with the best possible care. Stay informed and proactive to maximize these benefits and ensure better health outcomes. Thank you for watching, and take care of your health in 2025.